Tricuspid regurgitation, or TR, is a condition in which the heart's tricuspid valve does not close properly. Blood flows backward into the right atrium as the right ventricle contracts, and the effects of severe TR can significantly impair a patient's quality of life and end up being fatal. Dr. Williams is an interventional cardiologist who knows about TR's high prevalence and mortality rates, but has been hesitant to treat severe TR due to its complexity and limited treatment options. Until now. Edwards' innovative PASCAL transcatheter valve repair system overcomes three unique characteristics of the tricuspid valve which make TR treatment difficult. First, the tricuspid valve has much thinner leaflets than other valves, making them susceptible to tearing during leaflet repair procedures. PASCAL's distinct clasp design reduces stress on these leaflets, while super-elastic nitinol allows it to be flexible and gentle on native anatomy. Second, the coaptation gap between tricuspid leaflets is larger than that of mitral leaflets. PASCAL's independent grasping feature enables one leaflet to be captured at a time, allowing for optimal placement of the device. What's more, PASCAL's unique central spacer is designed to bridge larger coaptation gaps. Third, the dense chordae attached to subvalvular apparatus make it difficult to navigate and position other implants without entanglement. But PASCAL's unique ability to elongate facilitates enhanced maneuverability and safe repositioning. Dr. Williams is encouraged. PASCAL's features directly address her previous concerns, giving her the confidence to treat severe tricuspid regurgitation patients with the PASCAL transcatheter repair system. Interested? Visit edwards.com/PASCAL-TR or connect with your local Edwards Life Sciences representative to learn more.